Okay, we're here with Sandra today, and Sandra is about to start her treatment with Dr. Davis. So Sandra, tell me about your knee. When did it start hurting?
About 10 or 12 years ago.
And was it due to an accident or?
My dog slammed into my knee.
Must have been a really big dog.
Yes, it was a big dog.
Have you seen any other doctors for this knee?
Yes, I did. I saw an orthopedic doctor, and they did an x-ray, said it was arthritis, and he did give me one shot.
And how did that work out for you?
It didn't do anything. It didn't relieve the pain at all or discomfort.
So whenever you are having pain in the knee, what would you say that pain level is? 0 being no discomfort and 10 being unbearable.
About 5 or 6.
5 or 6? We got to get that down to nothing. Okay, and from my understanding, you like to exercise, correct?
Yes.
You like to do the Zumba and everything, so we got to get you back doing all of that again.
That's right.
All right, so Sandra, I'm going to have you stand up for me. Was there any discomfort doing that?
Just a little discomfort. I'd say maybe about a 3.
Okay, and could you point to where it was?
Right in this area.
Right on the outside there? And was it like a sharp pain? Was it like a stiffness? Was it tight? How would you describe it? It's a sharp pain. Mm-hmm. Yeah, that's not good. Okay, I'm gonna have you do a squat for me, so arms straight out in front of you. How low can you go? Okay.
Now I can feel it coming back up. I can
Okay.
feel the pain.
All right, and point to where the pain was again for me. That same spot.
Mm-hmm.
You think we found your hot spot. All right, so I'm gonna have you go up and down the stairs. If you can, just 1 foot per step, holding onto the railing.
Ooh, that's when it hurts really bad.
When it's bending and you're coming down, okay.
Oh yeah.
That's when it's hurting, it's when the leg is bending. Okay, let's go back up.
Ooh, that's when it hurts, when you put the weight on it.
Okay, coming up, it's when the weight is on it.
Oh gosh, yes.
So, Sandra, what would you tell me? Which is worse, going up the stairs or coming down? When is it more painful?
It's worse going down.
Going down the
So
stairs.
and then it's about an 8.
Okay, we got to get that taken care of. Let's get you in to see Dr. Davis.
Whatever we have to do,
All
I'm
right,
sorry.
we're here with Sandra. Sandra's finished her first treatment with Dr. Davis. So, Sandra, if you could stand up for me. Is that okay?
Much better, yeah.
All right, let's do that squat. Whoa. That's amazing. And you did it fast, too. All right, let's go up and down the stairs.
Much better.
And you're not even holding onto the railing.
better.
Oh, that's great.
I'm still like, you still feel a little bit, you know.
Well, it's not the first one.
Yeah, it's just my first visit, you're right.
So you were like a 5 or 6. What do you think it is now?
I think about a 4, 3 or 4.
3 or 4? That's
Yeah.
perfect. We haven't even started treatments yet. So what's the biggest thing that you've noticed, the change?
I do know when I'm walking, I'm feeling any pain.
There's no pain
And
at
when
all?
I'm squatting, I don't have to compensate when I'm squatting.
And wow, I mean, and you went down fast, you came up fast. All right, let's get you on some therapies.